Welcome again to Phallogisto. Today I have visitors in the studio, and before I allow them to introduce themselves, our today's session is going to be a practical session, which is a continuation of the theory that we talked about in our last session. Actually, our two last sessions, we've been talking about family planning, contraceptives, and now we are here to show you what exactly we've been talking about. So before we start, let me give our visitors a chance to tell you who they are.
I am Mwai Tuichuli.
And I am Matthew.
Welcome to the show. Okay, so we are going to start away with our demonstration so that we see how those theories worked that we talked about, since I'm also wondering how some of these things work. So Amoit is going to show us about the condoms, both female and male condoms, more about it.
I'm going to demonstrate how the male condom is used. So first and foremost, you check the expiry date because you don't want to go around using an expired condom. And after checking the expiry date, you'll check if it's okay. That is, if you feel the air inside, that condom is okay. Then to open, you check the serrated margin and you open from one part of the serrated margin. So you'll tear. You don't use your teeth, you just use your fingers, nails, if you have them. Then you just remove it from inside. Then you check from which part you should slide it on your penis. And yeah, from here you can see this is the right side. So you hold from the tip so that you remove any air that is present inside, because there are chances of bursting if there is air inside. You place it on the tip of your penis, then you slide it down gently, and that is it, and you're good to go. So after the sexual intercourse, and remember, one condom, one round. Do not use the condom twice, okay? So after that, after you've finished, for removal, it's good to use a tissue to remove the condom because you do not want to come in contact with the semen. So you just use tissue, you slide it back up so that you do not touch the semen. So you remove your condom. Wrap it inside the tissue and discard it appropriately, maybe in the dustbin. Please do not flush it in the toilet.
And also, to make the act more fun, I think you can have your partner put it on for you instead of you putting it on yourself. I'm sure I have a point there.
So we are done with the condoms. Then we are going to see how the female condom is used. Okay. This is a packet of the female condom. This has an indication of where you'll open it from. It's right here. So you just you remove your female condom, and this is how it looks like. So the wider circumference or the wider area will be outside, and the smaller area, the smaller circle, will be the area that goes inside. To insert, you'll position yourself, and I'll show you how you should. I'll show you how you should position yourself to insert the female condom. So one leg should be at an elevated ground, and then you'll either curl this one in this way or form a number 8. Then you'll insert from one side intravaginally. After this whole part is inside, you'll release it so that this part is outside and this one is inside your vagina. After inserting this whole part, you can either push it using your finger to go further inside, or you'll just leave it because it will go up by itself. So after use, just like the male condoms, you'll use tissue to remove the female condom, wrap it nicely with tissue, and then discard it appropriately.
So now that we are done with the condoms, and we are going to the implants. If you remember well, when we were talking about the theory in our previous videos, we mentioned implants. So I'm gonna demonstrate about implants. we have Jadel, and we have Impranol. So I'm going to tell us how we use both. So, okay, inserting it, that's the work of your health professional. So, of course, I'm not going to say how it's inserted. Your health professional will do that for you. But then important points to mention is we have this Impranol here, and then we have Jadel, which are usually two. So they're very thin, and let me show you so that you can see clearly. So this one, they're very thin, and they're they're free, so they can bend. Like when the doctor is inserting it inside, you don't feel any pain because of the elasticity and all that. So we are going to start with this one. They're usually 2 pieces. So when they're 2, that one is for 5 years. It can keep you safe for 5 years. But then you remember that none of these contraceptive methods is always 100%. So this one is also 99%, meaning 1 in every 100 people can get pregnant still in a year. So this one, I said you insert it under the skin, like your medical professional will insert it in your upper arm under the skin. So like here, if this one is my arm, this is my less dominant arm, like the arm which I use less frequently. So they will insert it here, but before the procedure, they usually inject you with an anesthetic which will make the place numb, so you won't feel any pain. The place might feel a little itchy, but you won't feel any pain, you just feel some slight penetration. So it's usually very comfortable. You will just try that and then they insert it. After the procedure, they will place a bandage there at the injected place. So you'll go with the bandage for a few days, then you can remove it. So you shouldn't be scared like after that, because normally there can be a sign of some bruises there, but it will disappear after a few days later. So this one are usually hormonal, like both Impranol and Jadel, they're usually hormonal. So actually they're the same, just that not this one, it's 1, meaning it's for 3 years. It's just inserted the same way, and basically everything is the same with the one I demonstrated earlier for Jadel. So that's it about implants. So we are going to talk about something else quickly.
So thank you so much for the demonstrations that have been done, and I would like to appreciate you continue to watch the video. I'm going to demonstrate use of 3 methods of family planning. Basically, I will start with the dairy pills, the microgynon, which you are expected to take 1 pill per day. So this is how it looks like. It has 2 kinds of pills. We have the one which are beige in color, 21 of them, which you are supposed to take in based on the direction of the arrows. So day 1 you take 1 pill, day 1, and then subsequent days going that way. And then the rest period, as we mentioned the last time, for about 7 days, you take the brown pills at the bottom. That's from day 21, from day 22 to day 27. It has been improvised in such a way that these brown pills are supposed to be placebo, but they have iron. So we know mostly ladies have they lose blood monthly, so they will benefit from iron supplementation. That's mainly the reason for the brown pills. But the most important thing to note is that you have to take these pills every day following this cycle. This will be able to help you to keep track of your progress in matters taking these pills. So thank you so much. And then we also have another method of family planning, as you can see here, what we call a Depo-Provera, the Depo injection, that is would provide protection for up to 3 months. So this one is injected into your deltoid, So it's basically a safe procedure. Your healthcare provider will get something like this one, and then it has a needle at the tip, which is going to be used to introduce this chemical into your body. So the area is cleaned nicely. Your healthcare provider will be able to inject this into your deltoid muscle of the less dominant hand, and then the procedure is done, and you are protected for the next 3 months before you can receive the next dose. Thank you. And then finally, we are going to demonstrate the use of intrauterine device, something that looks like this. I'm going to demonstrate the use of IUCD, intrauterine device, which is inserted into the womb. So before I mention how it is used, you need to understand the structure of the womb. This basically demonstrates a figure, a representation of the uterus, where we have this part here, the two horns, which represent the fallopian tubes, and then we have the uterine body here, and then the external opening of the cervix, and which opens into the uterus, and the outer part is the external opening of the cervix, which opens basically to the superior portion of the vagina, and then these other the sides here represent the fornices. So your healthcare provider will use a trocar, which we are not able to gather for this demonstration, and then we'll be able to insert this device through the external cervical os opening into the cervix, into the uterus, and then after insertion, now you will release the trocar, and this is the way this device is going to lie, with the two horns lying, or actually lying at the opening of the fallopian tubes into the cervix. Basically, in this manner, when the sperms have been deposited into your vaginal canal, when they swim up, they will get this device blocking their entrance into the fallopian tubes, where basically the fertilization takes place. So that's how basically it's going to protect you from conceiving. And then these two strings, the main purpose of them being here is for ease of visualization, especially during the time of removal of this device. So they are cut after insertion, and then the stump is folded through into the posterior fornix of your superior portion of the vagina. And then mostly people think that these strings will be able to interrupt or make the penis uncomfortable penetrating you, but that is not true, because they are not felt. So as we referred to in the last video, this IUCD will be able to protect you from conceiving for 10 to 12 years. And then it should be checked regularly by your healthcare provider, only when you feel you have excessive bleeding, any low abdominal pains, and such thing that you may suspect it is coming from or is related to the presence of the IUCD. So the healthcare provider will be able to regularly check for the strings to ensure that this thing is in place and it is correctly placed, and to ensure maximum protection from conception.
So that's it about our demonstration today. So about takeaway message, like we talked about so many things, so we are going to have each of us just summarize what they demonstrated here so that we don't get confused. So Amit.
Yeah, so I talked about the male and the female condoms, please be sure to check the expiry date and check if the condom is okay for the male condom. They are the easiest to use. Even this one, when you get used to it, it's just so easy to use. Please use protection. Always check the expiry date and always dispose of properly.
Wow. Okay, Wycliffe.
Thank you so much for the opportunity. I hope you've learned. They say information is power. Knowledge is power. So let's use the information to be safe. You understand, eh? Yeah. So just be sure to liaise with your healthcare provider to ensure that you have the correct information about usage of these methods of family planning.
Okay, thank you, Wycliffe. And guys, it's not a life and death thing. If one of these things doesn't work for you, go change it. Because this is your health we are talking about here. If it's having so many side effects on you, there are better options. As we talked about in our previous video, go check it. So otherwise, thank you for watching and hit the subscribe button because you won't want to miss other content that we have for you next.